Hi, my name's Kyle Morrison. I'm a student with the F&P program at Valdosta State University. This is my wife, Carly Morrison. Do you give consent to be part of this video?
I give consent.
Okay, we're going to do a full head-to-toe assessment as well as a H&P intake for a clinic. So to start off with, why are you here?
For a physical.
Okay, she's here for a physical. That'd be the chief complaint. Next, we're going to do the HPI. Basically, she's a well-appearing 28-year-old Caucasian female here for a physical examination. Now we're going to move on to previous medical history. First, we're going to start off with childhood illnesses. Any childhood illnesses we need to know about?
No.
No? Are you up to date on all of your immunizations?
Yes.
Okay. What about the flu vaccine?
No.
Would you like the flu vaccine?
Sure.
Okay. Let's see. Second, we're going to look at adult illnesses. Any adult illnesses we should know about?
Preeclampsia.
Okay, you've had preeclampsia in the past. That's good to know. Now we're going to look at any operations.
No.
No operations. Okay. Any allergies?
None that I know of.
Do you take any medications?
No.
Prenatals, vitamins, things of that nature.
Prenatal vitamins.
Prenatal
yes.
vitamins. Okay, good. Next, we're going to move on to family history. Do you have any siblings?
Yes.
Okay. Who?
A brother.
A brother. How old?
20.
Still living?
Yes.
Any history such as depression, anxiety?
Depression.
Okay. Let's see. What about your father? What age is he, and what diagnoses has he had?
He's 58. Hypertension and AFib.
Okay. Still living?
Yes.
Okay. What about your mother?
COPD.
Okay. Age? Still living?
56, as far as I know.
Still living. Okay. What about your paternal grandfather?
He's dead.
What did he die of, and what age?
I think colon cancer.
Mm-hmm.
85.
Okay. All right. What about your paternal mother or paternal grandmother?
She's dead.
Mm-hmm.
She died at 82, 83.
Okay.
Of, I guess, side effects of a stroke.
Okay. And then your maternal grandfather?
He's dead.
Mm-hmm.
That I don't know.
You don't know any diagnoses?
Mm-hmm.
No. What about maternal grandmother?
She was obese, but I have no other information.
Okay. So that covers family history. Now we're going to cover the social aspect of the history. Any drugs, alcohol, tobacco use?
No.
No. Any travel outside the United States in the past 30 days?
No.
Okay. What else? I'm drawing a blank. What's your financial situation?
Stable.
Stable. Would you say you're under stress?
Sure.
Okay. What's your occupational or occupation?
Stay at home mom.
Good. What's your education?
Master's degree.
Master's degree in
Social work.
Social work. Where'd you get it at?
Valdosta.
Good. So that covers all the history there. Now we need to cover your actual body. Okay, so I'm going to ask you questions and let me know if you've had any of these symptoms.
Okay.
So in general, have you had any kind of fevers, chills, heat, cold intolerance?
No.
No. For the skin, have you had any kind of change in skin pigmentation? Any change in moles?
No.
No. Okay. Any changes in temperature or texture of your skin?
No.
No. For your head, any kind of headaches? Visual disturbances?
No.
Changes in smell?
No.
Any nosebleeds?
No.
Okay. Any sore throats?
No.
No. Any mouth sores?
Not lately.
Not lately, but they do appear to heal.
Yes.
Okay. Let's see. Any tenderness of your throat?
No.
Enlargement of any kind?
No.
Okay. Any hearing issues, such as hearing loss, ringing in the ears?
No.
Okay. Breathing. Any trouble breathing, difficulty breathing? Any wheezing?
No.
No. Let's see. Any, for your heart, any palpitations where your heart feels like it skips a beat?
No.
Any episodes where you feel dizzy?
No.
Or pass out?
No.
Called syncope. Okay. What about neurologically? Any changes in memory?
No. Mom brain, but...
Mom brain. That's good. Any changes in sensation?
No.
Okay. Your stomach? Any changes in bowel movements?
No.
Any pain in the belly?
No.
Okay. Any distension that you've noticed, or weight gain?
No.
Or weight loss?
No.
Okay. How's your appetite?
I eat.
Well?
Sure.
Okay, good. Let's see, now your extremities. Any changes in range of motion?
No.
No? Full range of motion everywhere?
Yes.
Okay. Any broken bones that you've had in the past?
No.
Okay. So that covers everything head to toe for the review of systems. Now we're going to actually do our full head to toe assessment. So first we're going to start with the head. The head is normocephalic and atraumatic, no signs of, no visible signs or palpable signs of trauma of any kind, scars, bumps, or lesions. Then we're going to move on to the face. For the face, if you would, raise your eyebrows, lower your eyebrows, smile, frown, bigger, good. Puff out your cheeks, good. Then we're going to test the TMJ, good. No popping or crackling noted. And then we're going to assess the frontal sinus with light percussion. Any tenderness?
No.
Okay. Ethmoid? Any tenderness?
No. No.
Sphenoid?
No.
Okay. Maxillary?
No.
No. Okay. That takes care of that. And then we're going to assess soft and sharp pain sensation. Okay. So close your eyes. All right. This is sharp. Okay. This is soft. Can you tell a difference?
Yeah.
Okay. So what's this?
Sharp.
Good.
Soft.
Good.
Soft.
Good.
Sharp. Soft. Sharp. Sharp. Soft.
Good. So that takes care of the face. Now we're going to move on to the nose. We're going to move on to the nose. So for the nose, I'm going to grab my light source here. In this case, I'm just going to use my otoscope. Okay, tilt your head up. Still, yep. Okay, I'm just going to raise your nose a little bit. Septum does not appear perforated, no signs of trauma, no arrhythmia, no swelling of the turbinates. And the septum is midline. Good. Okay. Mucous membranes are pink and moist, intact. Now we're going to assess the eyes. So for the eyes, I have my ophthalmoscope. Get that prepared. Okay, so first we're going to test visual acuity with the Rosenbaum chart.
Okay.
Hold this approximately 36 centimeters away from your eyes and start at the top and read your way down to the bottom.
With both eyes?
With both eyes first.
95874 2843 638 8745 63925 428365 374258 937826 426739.
Very good. So that is a vision of 20/20 of both eyes. So OU. And then if you would cover your right eye. Okay, so we're testing the left. Do the same.
95874 2843 638 8745 63925 428365 374258 937826 426739.
Okay. So OS, or left eye, is also 20/20. And now we're going to test OD.
95874 2843 638 8745 63925 428 365 274258 937826, and I cannot read the bottom.
Okay. So that was 20/25. Okay, so we'll make a note of that. Now we're going to test your cranial nerves. So if you would, look at my nose, okay? And I'm going to test your peripheral vision. And I need you to tell me when you can no longer see my fingers. Okay? Here they are.
Can't see them.
Good.
Can't see them.
Good.
Can't see them.
Good. So peripheral vision's intact. Now we're going to do the 6 cardinal fields of gaze. So here's my fingers. If you'll follow them with just your eyes. Good. Okay. So cranial nerves 3, 4, and 6 are intact. Now we're going to take our ophthalmoscope. We're going to look at my nose. We're going to look for consensual response, which, by the way, the cardinal fields of gaze, she did have accommodation noted. So consensual response is there. And then we're going to look at the pupils for being round, reactive to light, which they are. And then we're going to look inside the eye at cranial nerve 2 and look for the optic disc, make sure it's well marginated and no signs of AV nicking or neovascularization. So if you would, just stare straight ahead. Okay. Now I'm going to come to from the side here. Okay. So the AV disc is well marginated, the optic disc is well marginated, no AV nicking, neovascularization. Now same for the other eye. Okay. Good. All right. Same thing. No signs of the optic disc being pushed out, as it were, or any signs of neovascularization or retinopathy damage. So cranial nerve 2 is intact. Now we're going to also assess the mouth. So if you would, open wide. Good. Say ah. Uvula rises midline. Tonsils are +1 hidden within the pillars. Stick your tongue out. Move it side to side. Good. So that's 9, 10, and 12 are intact. The cranial nerves. I'm also going to do a smell test.
Smell or taste?
Both.
Okay.
Alright. So, this stick has a flavor on one side and a scent on the other side. Okay, tell me what the scent is.
Grape.
Very good. And then this side, okay, open wide. And there we go. Gag is intact. And
it tastes like grape.
It tasted like grape. Good. Tried to trick you and I didn't. Good? Okay. Sorry about that. So now we're going to move on to the ears. So I'm going to get my otoscope. Okay. So first off, we're going to look at the auricle here. Any tenderness?
No.
All right. The tragus? Nothing.
No.
Pinna?
No.
No. Okay. No buildup behind the auricle. And then we're going to take a look inside. Okay. Tympanic membrane. See the pars flaccida, pars tense, the malleus. Cone of light is at the 7 o'clock position. Ear canal is non-arrhythmic. Slight cerumen buildup, but the tympanic membrane is in neutral position. No evidence of bulging. Okay. Now we're going to check the other ear. Same thing, same process. No buildup behind the auricle. Okay. No tenderness of the pinna, tragus, or the auricle itself. Correct?
Correct.
Okay. Now we're going to take a look inside. Ear canal, non-arrhythmic. Some buildup of cerumen noted. Tympanic membrane is pearly gray. Cone of light in the 5 o'clock position. And notice the tympanic membrane is in neutral position. So that takes care of the ears other than the hearing test. So first we're going to do the whisper test. Whisper test, if you would turn that way. Occlude, or press down so you can't hear. Okay.
Puppy.
Very good. Okay, same with the other side.
Flower.
Very good. So that takes care of that. Keep an eye on that. So, takes care of the whisper test. Now we're going to do the Renee and Weber test. Possibly. Here it is. It's stuck. Alright. So, for the Weber test, I'm going to strike the tuning fork and tell me which ear you can hear it the best in, or if it sounds similar in both.
Okay. Both.
Good. Normal finding. And then for this test, the Renee, I'm going to strike the tuning fork, place it right here on your mastoid process. You tell me when you can no longer hear it, and then I'm going to move it in front of your ear, and I want you to tell me when you can no longer hear it. Okay? So...
No longer hear it.
Okay. Okay. So normal AC conduction should be twice bone conduction. In this case, it was a tad short, but that was probably user error because the tuning fork was actually touching her hair for some of the test. So let's try the other ear. Perfect. That time we had a successful test. So that takes care of the ears. Now we move on to the neck. For the neck, first we look at the trachea. It is midline. Then we're going to assess the thyroid. Okay. No nodules noted. No swelling. Swallow. Good. Thyroid is palpable. Nice symmetric rise upon swallowing. Then we're going to test the carotids. Good. Good. +2 equal bilaterally. We're also going to listen to the carotids. No bruits noted. Okay. And then we're going to test shoulder shrug. Shrug your shoulders. Good. Turn your head towards me. And then turn. Good. So against resistance, cranial nerve 11 is intact. Now we're going to move on to the anterior chest. Anterior chest, we're looking at even respirations, no use of accessory muscles. Then we're going to move on to percussion, where I expect to hear resonant sounds going in the second intercostal space. Good. Good. Okay. Third intercostal. Fourth. Okay. Then I'm going to check down here. Excuse me. And there you go. Good. So that takes care of percussion. And then we're going to also do palpation. So listening for, or feeling for tactile firmitus. Say 99.
99.
Good.
99.
Good.
99.
Good. Tactile firmitus is palpated. Now we're going to auscultate the lung fields. Just every time I place my stethoscope, do a deep breath in. Good. You're okay. Good. Okay, now we're going to listen to heart sounds. So first we're going to listen to the aortic area in the second intercostal space, right sternal border. S1, S2 noted. No extra sounds. Pulmonic area, S1, S2 noted. Second intercostal space, right, left sternal border. Third intercostal space, we have Erb's point. Tricuspid in the fourth intercostal space, left sternal border. And then mitral, midclavicular line. Excuse me. Midclavicular line, left side. S1, S2 noted. Now we move on to the back. The back, we're going to follow the same steps, except we're going to add in respiratory excursion. So take a deep breath out.
Out.
Out. Out, 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 out. Okay, now take a deep breath in. Good, so symmetrical expansion. Now I'm going to listen, palpate for tactile firmitus. Go ahead, say 99.
99.
Good.
99.
Good.
99.
Good. And
99.
good. Okay, now we're going to percuss. Resonance noted. Okay. Then we're going to auscultate the back for respiratory breath sounds. Just deep breaths. Good. 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 All right, so now we're going to move on to the abdomen. So if you would, lie back, and the patient should be at a 30-degree angle. This is 30 degrees for our sake. And what we're going to do is we're going to have the patient turn towards that side, the left side. We're going to go ahead, turn. There we go. Look for the maximum pulsation. Go to the suprasternal notch, which is right here. Oh, that's okay. I'm describing. All right. So I'm going to take my measurement at the notch in a straight line where the maximum pulsation is, and it is at 4 centimeters, which is within the normal range of 3 to 4. Okay, so now we're going to actually inspect the abdomen. For the abdomen, go ahead. For the abdomen, we look at the contour. It's flat, non-distended. Then we're going to auscultate all 4 quadrants. Right upper, right lower, left lower, left upper. Okay, bell sounds are normal active. Then we're going to listen to the abdominal aorta for bruits, the iliac arteries for bruits, and the renal arteries for bruits. No bruits noted. Now we're going to percuss in all 4 quadrants. Tympany is noted. Now we're also going to do a liver scratch test for percussion. And what we're going to do is go just below the xiphoid process. And we're going to get a liver span. Sorry. So liver span is 7 centimeters. That's within normal range. Now we're going to do light percussion, light palpation. Any tenderness noted? Okay, no signs of masses, anything like that. We're going to do deep now. Any tenderness? Okay, of all 4 quadrants. We're also going to take a deep breath in and out. Liver is palpable, just on the edge there. And one more time. Spleen is not palpable. Now we're going to assess skin turgor using the chest here. Skin is non-tinting. We are also going to assess the skin in general. No pallor noted, no cyanosis. Skin is warm, dry, intact. We're also going to assess the pulses. So radial, +2 equal bilaterally. Posterior tibial. +1 equal bilaterally. Pedal +2 equal bilaterally. Just for fun, popliteal. +1 equal bilaterally. So now, if you would, sit on the edge of the bed. We're going to assess reflexes. So first, we're going to do the tricep. Good. And then we're going to assess ragdoll. What are you doing? Here, relax. Okay. There we go. Okay. Good. Relax your arm. Good. That takes care of the biceps and triceps. Tendon reflex, deep tendon reflex. Go ahead and sit more on the edge of the bed so you can relax. Okay. Then we're going to test the patellar. Whew. Say that's brisk. And then none. There we go. All right. And then let's test your Achilles. Good. Good. All right. So that takes care of the reflexes. Now we're going to test range of motion. Range of motion, if you would, look up for extension, look down for flexion, look straight ahead, do ear to shoulder, ear to shoulder. That's lateral flexion. Then let's do rotation. Good. No limited range of motion. Now let's do the arms. Arms up towards the sky is flexion. Then we're going to extend it behind us. Good. And then we're going to cross it for adduction. And then for abduction, we're going to do like a jumping jack. Good. So no limited range of motion. Now we're going to do the spine. We're going to flex by bending down and touching our toes. Good. We're going to bend backwards for extension. Good. We're going to do lateral flexion. Good. We're going to also do rotation. Good. full range of motion. Now we're going to move to the knees and the hips. Knee to chest. Knee to chest. Wait, you're cheating with the...
Oh.
All right, good. Now we're also going to do the legs. So for the legs, if you would, cross it over the other leg. Good, that's adduction. Abduction, you'll take the same leg and move it to the side. Good. And then do the same for the other. Good. And then move it to the side. Good. So that takes care of range of motion. And then we have a couple more tests. And then that'll conclude our session. So first, we're going to do cerebellar. Okay, so if you would stand. Okay, the patient is going to close her eyes. Arms are straight out. Okay, and I'm here for support for the patient. And close your eyes. Sorry. Feet are together, and she's not supposed to sway. And then, so the Romberg test is negative, which is good. And then go ahead, relax. You can open your eyes now. And then I'm going to have the patient walk heel to toe, 3 paces. And then turn around and come back. Good. Okay. And then lastly, we're going to do proprioception. So if you would turn towards me. Okay. Close your eyes and hold your arms out. Is this up or down?
Up.
Okay, good. It's up or down?
Down.
Good.
That might.
Yeah.
Up. Down.
Good. Same with this.
Up.
Very good. Proprioception's intact. Now, stereognosis. We're going to take 2 objects and test it in her hands and see if she can see and differentiate which one's which. So if you would, hold out your hands, close out your eyes, or close your eyes. Tell me what this is.
Paper stick thing.
Paper stick thing. Close enough. Okay? Tell me what this is.
A card. The eye thing.
The eye thing. Okay, good. Stereognosis is intact. And that concludes our video. That's a full head-to-toe assessment, intake into the clinic for a history. That's it. Thank you.